Meanwhile, the Health Department has confirmed the local transmission of the highly contagious Omicron XBB subvariant and XBC variant. In an online town hall meeting, DOH Epidemiology Bureau Director Dr. Aletea de Guzman said the country's XBB and XBC cases are not linked to travel. De Guzman also noted that the transmission is still localized because the variants were detected in select regions. To date, the Philippines has recorded 81 XBB Omicron subvariant cases, while 193 cases of the XBC variant have been reported. Now, here to discuss the possible impact of the XBB subvariant and XBC variant, we have on the line Dr. Jose Rene de Grano, President of the Private Hospitals Association of the Philippines. Good evening, Doc de Grano. Welcome to The Big Story. I guess first things first, have we been seeing a rise in COVID-19 hospitalizations after, of course, we have, at least the DOH has reported the local transmission of the new subvariant and variant?
Yes, yes, sir. Good evening. There's only we're observing a very slight increase in our private hospitals of our last report, and then probably we should be observing more in a week or two if there is really going to be an increase in the admission.
Okay, circling back to one of our top stories, the Health Department has confirmed the local transmission of the highly contagious Omicron XBB subvariant and the XBC variant. Now, to talk to us more about this, let's welcome back on the line Dr. Jose Rene de Grano, President of the Private Hospitals Association of the Philippines. Doc de Grano, good evening and welcome again to The Big Story. Now, earlier, I was asking you about if you had at least recorded a rise in hospitalizations for COVID-19 wards, especially for regions wherein there's been a reported local transmission of the XBB and XBC. Of course, we're referring to Region 6, 11, and 12. So were there any increases?
Right now, yes, we are. There is an increase in the regions you mentioned, 6, 11, and 12. But here in the region, in the NCR, in Region 4, there is only a very slight increase in the private hospitals. Yes.
Okay, so there's been a slight increase, but is that level of increase, at least in the regions that you mentioned earlier, are they alarming?
They have surpassed usually we have around 30% occupancy in the COVID wards, but right now I think they are reaching around 40 or more % of their COVID beds.
So around 40% still tolerable pa? Pag ganung level,
yes,
Dr. Grano?
It's still tolerable and it's still low risk as of the moment. But we're trying to, observe the next 1 or 2 weeks if there's going to be an increase in other areas also.
Okay, so at least the next 2 weeks will be very crucial for us to determine whether there's going to be an alarming increase in terms of hospitalization. Now, following the DOH's announcement, is PHAPI looking at implementing any new protocols to ensure that these cases could easily be addressed?
Well, actually, we have the same protocol, no? Probably we'll just have to be more strict, especially in those areas where we have, or in the COVID wards of the hospitals. We should be more strict in the implementation of their minimum health protocols. Yes.
All right. Again, thank you very much for those updates. PHAPI President Jose Rene de Grano. Thank you, Doc.